slides available to those who are a part of this webinar and for the rest of our members. We'll also be releasing just an administrative procedural one-pager as I've done in the past when we release the slides and this recording. So with that, let's get started. Maybe. There we go. So the roadmap for today, as you can see, we have a lot of information to cover. This NOFA was quite a bit different than it has been in years past. We're hoping that all of that will be good for folks who are trying to provide housing and services to young people. So first, we're going to go through what's the NOFA, some policy priorities as they've changed a little bit, discussion on reallocation and the permanent housing bonus, and then how that ties to dedicated plus, rapid rehousing, and the joint component. We're going to look at the youth-specific highlights, and then the overall consolidated applicant point breakdown. It's just helpful for you all to have that in the back of your mind as you're doing your independent or individual project applications. Of course, I have the slides in there for the procedural process. I think quite a few of you that are on this call have seen that before, so I don't want to spend a whole bunch of time on it. Like I said, there will also be a one-pager available to everyone who is on the webinar about that procedural process. And then we'll briefly go over some application strategies, both for success and some strategies to avoid. So what is the NOFA? U.S. Housing and Urban Development's Notice of Funding Availability for Continuum of Care Programs. This is a competitive process. And this year, for fiscal year 2017, there is a $2 billion funding bank available. So last year it was 1.96, so we're up. This year, hopefully, that will allow for some expansion projects. We'll talk about their restrictions on new projects in just a second. So what does that funding go towards? It goes towards various housing projects, and then supportive services only. They're calling SSO CE because the supportive services only should be tied directly to coordinated entry. And then, of course, funding available for HMIS administration. So those policy priorities that have been drawn down from last year quite substantially. This year we've got ending homelessness for all persons. Last year and the year prior, this was broken out into all of those subpopulations. So now they've got just one overall policy priority to end homelessness for all persons. Of note in this section is really that COCs need to be using local data to determine the characteristics of individuals and families in their area with the highest needs and the longest experiences of homelessness. So they're really trying to get at the community level information about what the need is and how housing and supportive services are tailored to meet those needs. Next up, we've got creating a systemic response to homelessness. So COC should really be using system performance measures, things like the average length of homeless episode, the rates of exit to permanent housing, rates of return to homelessness, things like this. And then when we are looking at using coordinated entry, we should be using coordinated entry to promote participant choice, coordinate homeless assistance and mainstream housing and services to ensure that people are receiving assistance quickly and that the homelessness assistance process is open, inclusive, and transparent. I know in past that has been kind of an iffy area, and so we're really happy to see all of that really spelled out very clearly this time. So strategically allocating and using resources. Again, looking at the local data, performance, system performance measures, costs, etc., and reviewing project quality, cost effectiveness, and encouraging everyone to maximize the use of mainstream and other community-based resources when serving all people experiencing homelessness in your community. Finally, of course, once again, this year we see the reoccurring theme that we've seen for the past couple of years in using a housing first approach. They're really pushing housing first again this year, so prioritizing rapid placement and stabilization, doesn't have service participation requirements or preconditions, helping individuals and families move quickly into that permanent housing, and then figuring out what's needed after that. So COCs also in this section should engage, they're spelling out this year that COCs should all be engaged, and everybody involved in the COC should be engaging landlords and property owners, removing any barriers to entry, and then adopting that client-centered service method. And you'll see that emphasis on client-centered service methods is really drawn throughout this entire application. So moving on, what do we have when we're talking about reallocation versus new projects? HUD has been relatively clear this year that no grant awards for new projects will be awarded other than through reallocation unless projects are competitively ranked based on improving system performance. So the COC, if they are going to accept a new project that's not through reallocated money, they have to be able to show that they have competitively ranked that based on a system improvement and performance measure. So the reallocated funds can be used to create new projects, however, so you just have to go through that reallocation process to get a new project started. So what kinds of new projects can be started with the reallocated funding? We've got dedicated plus or permanent supportive housing, where 100% of the beds are dedicated to chronic homelessness, rapid rehousing, the new joint transitional housing and permanent housing rapid rehousing component projects, or what we're just calling the joint component projects, homeless management information system, HMIS, that supportive services only and coordinated entry, like we talked about before. So you can see the ones with the asterisks are the ones that we're going to go into in more depth. The permanent housing bonus this year is up to 6% of the COC's final pro rata need for the following new projects. So we've got that permanent supportive housing project where you've got those 100% dedicated beds to chronically homeless families or individuals, or the dedicated plus projects. Additionally, rapid rehousing and joint component projects specifically. So joint component projects can be funded either through, and we'll go over this again in a minute in a little more detail, but can be funded either through the permanent housing bonus money or through reallocation. So this permanent housing bonus and how it ties into expanding projects. Permanent housing bonus funds may be used to expand an existing project to services that are not currently funded under the CoC program in order to increase, say, the number of units in the project, the services that are being offered, or serving additional folks in the area. So to expand an eligible renewal project, you're going to need to have on hand when you're filling out the, I believe it's the 3C form through eSNAP. You'll need to have your renewal grant number. You'll need to indicate how and by how many beds you will expand, or services or persons served, and how, that should say HMIS will be expanded. Additionally, you'll also need to be ready to specify that you can ensure your funding request will be within the parameters of reallocation or the permanent housing bonus. So making sure that you're not, just because you want to expand by 4 or 5 beds doesn't mean that you are going outside of the amount of money that's available for reallocation. So what is Dedicated Plus? Because this is the first time that we've seen it in a CoC NOFA. It's permanent supportive housing with 100% of beds dedicated to individuals or unaccompanied homeless youth with disabilities. Or in the case of a family, again, this is a definition that we're all familiar with, when at least one adult in the family has a disability that qualifies. And then that at intake, they are either chronically homeless, residing in transitional housing that's being eliminated under this current funding cycle, and the individual was chronically homeless when they entered transitional housing, literally homeless, but chronically homeless had been admitted, so literally homeless being right on the streets, staying in a place not fit for human habitation, in an emergency shelter, but chronically homeless and had been admitted to permanent housing within the last year, but for some reason was unable to maintain placement. Additionally, they could also be residing in transitional housing that's funded by the joint component, and they were considered chronically homeless when entering the project. They could be literally homeless, again, on the street, staying in a place not fit for human habitation for at least 12 months within the past 3 years, but not on more than 4 separate occasions. Or they could be receiving VA homeless assistance plus any one of the above. For our purposes, that last one is probably not going to be as relevant, but I wanted to make sure to spell all of it out just in case. So rapid rehousing through permanent housing bonus or reallocation. New rapid rehousing to serve can serve those who are residing in places not fit for human habitation in an emergency shelter. Includes category 4, so those people escaping abnormally dangerous situations like domestic violence, human trafficking, etc. Anyone who has been residing in transitional housing that is going to be eliminated under this NOFA, and residing in joint component projects. Again, there's the Veterans Assistance Homeless Services qualification as well. Moving on to the new joint transitional housing and rapid rehousing component, we've got, at a minimum, these projects need to be able to use a housing first approach. They need to be client driven, and there can't be mandatory services. The low barrier entry and accommodations for people with possessions, right? So say partners, pets, and other needs. So say somebody is moving in with an animal or with a significant other, we need to be able to accommodate for that under this idea. Now, if there are licensing requirements in your state, make sure to check with your state folks to make sure that that would be okay. Obviously, there may be some issues with, a 17-year-old wanting to move into the crisis housing, transitional housing portion with their 18 or 19-year-old boyfriend. But again, like I said, make sure that that is something that you discuss with your experts in your state on licensing. So we've also got there needs to be, the crisis housing portion is what they're kind of is what they're calling the transitional housing. So you come into, theoretically, you would come into the crisis housing section and then move into permanent housing. But it has to be, this is going back to that client-driven part again, it has to be at the time of the client's choosing. Some, especially with youth, being as unique as each one of them is, there may be some that need to be in the transitional housing portion or that crisis housing portion for longer. There may be some that just need to get in there until they can find the rapid rehousing unit that they would like to move into. So that's going to be on a case-by-case basis, but having that flexibility We're happy to see that from HUD's mouth, but we are also really, really excited to see that because it does show that they are taking into consideration that other populations don't really fit the structure that had been there in the past. Some of you may have been at our 2016 National Summit here in DC. This is the project that Annaleva was referring to during our federal agency roundtable discussion when she gave us kind of a preview that there may be some sort of fusion type model coming out. So I think it's pretty clear in the outlines that they're trying to have some sort of program out there for youth and young adults. Additionally, the resources available need to be targeted to improving safety, well-being, and achieving specific goals. Now, while that seems prescriptive on paper, on the ground, that actually also gives us quite a bit of flexibility to work with young people. We want to target and prioritize people with the highest needs and the most vulnerable. Of course, that hasn't changed from HUD's priorities. And then making both, so this is another piece where it can be a little tricky. We have to be able to provide both the TH and the rapid rehousing to all participants, but it's up to the client whether they want to take advantage of both or whether they come into your program and say, I don't need the transitional housing, I'm ready to go straight into rapid rehousing. That's fine. They don't have to engage with both. We just have to make both available. There is still a 24-month limit combined between the two, so they can be in the joint component all together for 24 months. It doesn't matter how that 24 months is really divvied up, it does not seem. And from what I have heard here in DC and from our friends over at the United States Interagency Council on Homelessness, these projects can be used to serve Category 2. That's that imminently homeless section. And if there is report language, again, about 24 and under, not needing to, not being pushed to provide that piece of information saying that they'll be, on their, out of the place that they've been staying for 14 days, because of all of the risks that it brings up for them, then this would be a great project to be able to really catch those young people before they get put out on the streets. So going into a little bit more of the joint component, so some community considerations, really this is coming from HUD, and this is what they are going to be paying attention to. High rates of unsheltered and crisis housing. So making sure that your shelter stays in your community have been relatively brief. I think that is because they want to try to minimize the amount of transitional housing and the crisis housing portion of the joint component, while increasing the ability for them to serve and move rapidly into rapid rehousing those that are experiencing unsheltered homelessness. That would be in line with many of their priorities as well in their policies. So if a community doesn't have any emergency shelter or crisis housing for those that are escaping dangerous situations, that would definitely put this type of project at the top of the list. And then that there's transitional housing available, but not able to provide participants with the financial resources to then move from transitional housing into permanent housing. And since we're still a little iffy about moving folks from transitional housing into rapid rehousing, that type of community would be perfect for these projects. So things that you want to show how the project will improve system performance, especially take into consideration the time taken to move into permanent housing, flexibility of meeting a variety of needs, especially when we're talking about young people, and then the scale of connections to those community resources. So if your program really has a great relationship with the single point of contacts on a university campus, for example, that would be a really, really good thing to highlight in your application. Or if you work really closely with healthcare for the homeless, your local healthcare for the homeless, things like that, relationships with your labor and workforce board, et cetera. So can we apply for new transitional housing? Not really. Only new transitional housing as the joint component projects are going to be allowed under this NOFA. However, existing transitional housing projects are still eligible for renewal. So even if your community has a transitional housing that they're not going to close, they can still apply for renewal funding, which is great. So if you know that you're among, and this is a little bit of an aside, but this is, the national network looking at the totality of the circumstances and saying, all right, so we've got close to 100 transitional living program providers whose grants are ending in April of 2018, and have been told that they either need to change geographic location or population in order to have applied under this under the current funding cycle. So if you weren't able to apply, this may be something that you consider applying for and talking to the CoC about reallocating the funds for a new joint component project. It will allow you to have that flexibility between transitional housing and rapid rehousing. So we've got some stronger language around the youth highlights from this NOFA. So some of those are that the Category 3 is still Category 3 being those that are considered homeless under other federal statutes and definitions. So that hasn't really changed all that much, except of course they altered it a little bit to include the joint components and state that they are eligible for joint component as well, as long as the CoC is approved to use up to that 10% of their funding for serving this population. We've got the coordination and engagement. So in the past, it had said, it had strongly suggested that CoCs work with youth service providers. However, this year, in order to receive maximum points, a CoC must at a minimum be able to demonstrate participation from youth service providers. So hopefully, we're seeing that they're starting to hear that there are still some communities that are having difficulty bridging that gap between the youth service providers and the traditional housing and urban development CoC providers. So we're happy to see that. Again, these are all the page numbers for this current NOFA. So if you always should go through and read it yourself. But if you need a quick reference, there you go. And then we've got some increased points for the youth PIT count, which is great under this year, and specification that CoCs won't be penalized for increasing youth numbers due to becoming more effective at doing youth counts. So again, something that we've been talking about and are happy to finally see in writing. However, there were points, there will be additional points for decreasing the number within the PIT count of households with children and youth. So you win some, you lose some. We'll have to look next year, I think, after the baseline, all of the baseline stuff, and see what happens in the following year as far as especially young parent families. We know that they don't quite fit into the HUD category of households with children and youth, but they also don't fit in nicely to individual youth experiencing homelessness. So we'll continue, National Network for Youth will continue to do some work around that gap. And then finally, and we're going to go into this a little bit more on the next slide, COCs can achieve up to 15 points for progress toward ending youth homelessness. So what does that look like? This point allocation is very different from last year's, so please take note that this is on page 52 to 53. You're definitely going to want to read through this to get all of the specifics. But I will try to get through as much of this without being redundant as possible. So up to 2 points for prioritizing unaccompanied youth based on need. So some of those factors to consider are history of or vulnerability to victimization, any history of DV, sexual violence, childhood abuse, trafficking, the number of previous homelessness episodes, how many times have they been unsheltered, any criminal history. I think that there's an argument there for criminal history that is tied especially to status offenses. And then bad credit or rental history. Remember, many of our young people have a family member somewhere along the line that has used their social security number to start a utility bill in their name, and then it goes to collections. So helping, being able to highlight that that is a trend in your community and that your program can address that appropriately would be very helpful. So up to 5 points for strategies that address the unique circumstances and needs of unaccompanied homeless youth. Again, really, this is them emphasizing for, I think, the second or third year now, that they recognize that youth are unique and that every single young person that presents has their own experiences, and that a blanket approach isn't going to work. And of course, with all of the expertise of youth service providers, you can really doctor that up to get a good amount of points out of that section. So there are 7 points for strategies used to increase availability of housing and services within the COC for youth, including securing additional funding. So, if you're able to show that your program also has a street outreach program attached to it, but that street outreach program is funded through FSBE and the Runaway and Homeless Youth Act, that may be something that also helps you increase your points for your COC. And that would be really great, especially to show that the strategy of having street outreach folks that are out there that are focused and understand the nuances of building those relationships with young people and using that relationship to bring them into programs and really make that a point of contact would be great. And then there's 1 point for showing that there's collaboration between the COC and youth education providers, so the McKinney-Vento liaisons in the area especially. I believe that was down from, it may have been up to 1 point last year as well. We would like to see that continue to go up because we know that's still an area that needs some improvement. But again, the fact that they're calling it out at all is better than nothing. So those consolidated applicants, that 200-point scale that the COC is going to be looking at overall, this is what I was saying is just good for you all to have in the back of your minds as you're going over those final steps of your individual project applications, thinking about the fact that there is that 43 points for coordination and engagement. The project ranking, reviewing and capacity, so making sure, just 1 second, lost my page. Okay, so making sure that those projects are really being ranked on a competitive scale, and also looking at the system performance and how all of that ties together. HMIS, having a good HMIS will give up to 13 points. The PIT count is up to 6 points. We just had a baseline year count. Next January won't be required. However, there will definitely be, I think, an emphasis for communities to continue using some funding for doing an off-year PIT count, especially if it means that they are continuing to grow and learn and increase efficiency when it comes to the youth count portion. And then that system performance evaluation, 49 points, and the biggest of all of the categories is performance and strategic planning. So just to have in the back of your mind. So these are the procedural deadlines. So the CoC applications have to be in by September 28th, which means that your individual project application needs to be in 30 days before that, which is August 29th. So you've got 2 weeks from today. And then the CoC will have to notify you whether they plan to include, reject, or reduce the amount that you've applied for 15 days before the full CoC application deadline. So we've got most closest in time is the project application deadline, 14 days from today. September 13th, the date of notification, and then September 28th is the full CoC application, or if your project application is rejected and you decide to fill out a solo application, that date will also apply to you. So what happens, notification of rejection has to be in writing, has to be communicated to you outside of the eSNAP system, and there has to be an explanation for the rejection. If all of those circumstances are met, then you can appeal directly to HUD by submitting a solo application in eSNAP. Again, that deadline of September 28th by 8 still applies. And then also make sure that you keep any of the communications about the rejection, because they will want that attached. So what do you do if you didn't receive that written notification? Follow those same steps, except you have to attach some additional information, and that additional information is evidence that you tried to participate in the planning process, that you submitted an application within all of the local deadlines. Your CoC may give slightly different deadlines, but they should put that on their CoC website or the lead agency's website if they don't have a CoC website. So check that to make sure that they're not, I haven't heard of any communities that steer away from the HUD prescribed dates, but just in case, better to be safe than sorry. And then a statement that you were not provided a written notification. And I suggest very heavily that if you were not provided written notification, keep any correspondence, logs of phone calls or meetings that you had, and follow up with any of that information in writing so that you have all of the relevant evidence that you could possibly need. Some application success strategies, really being proactive. Even though that CoC should be reaching out to you to be involved in the planning process and participation, especially since it's mandated under this NOFA, reach out to them anyway. Just be the squeaky wheel, and make sure that you're advocating to and for viewing the performance scorecards and ranking and how projects are being ranked during the process. The reallocation of funding from projects no longer meeting the needs of the populations experiencing homelessness in your community. So if you're in a community, for example, who has met the definition of ending veteran homelessness, opening another shelter with 125 beds dedicated solely to chronically homeless veterans may not be meeting the needs of the population in your community. And so that would be, something to have a discussion with the CoC about. Why are you doing this? What else could we be applying that to that may be more helpful to us ending homelessness amongst all populations? So youth providers are really important to the CoC to show that there's those 2 points that are available for not having barriers for having a criminal record, so decreasing the criminalization of homelessness and providing services and housing for young people, especially our programs. If it's a status offense, especially that's stuck on their record, then that would be a great place for us to be able to show, hey, our programs are already meeting this, and so by including us, you're one step closer to achieving those 2 points. And then always, always, always thoroughly review your application for accuracy. Make sure, go through it 2-3 times, take a break, send it to somebody else, have them read it, read over it again the morning of the 29th before you hit submit, and make sure that you have everything in there that you need. So this is very similar to last year. Strategies to avoid, again, you really don't want to, as a CoC, they don't want to shave a little from each project, especially with so many new project models that can be reallocated to. That would be, I think, a disincentive for HUD to fully fund. And then not using a closed objective ranking system. So the more that you can be engaged as potentially a new project or an expanded project or something along those lines, then that will show that they're really actually being objective and having an open ranking system process. So make sure that you're involved in that. And then not skimping on data and the planning to show the need, right? There was really an emphasis on being able to show the need this year. And as always, don't leave money on the table. So with that, I've got a list of some helpful resources here. Like I said, these slides will be made available, I'm hoping, by tomorrow for everyone who is on this webinar. I will email each of you directly if I have your email address. If I don't, shoot me an email and I will make sure that you are included. And then it will also, all of this will also be made available for folks who, so if you have colleagues that couldn't make it on here, let them know. I will be putting a link to all of this in the Thursday Why I Love RHYA newsletter that goes out. In the section on the one-pager that will also be attached to the slides when I send them to everyone, there are some additional resources on the independent project, individual project application specifically. Those are really, really detailed and really, really good. So if you come to a section in your application that has you totally hung up, I definitely would refer to that guide. So with that, I will open it up now. We did keep a rather small group, so I am going to, in about 3 seconds, unmute everyone. So if you are on the phone, please mute yourself from your own end, and I will open it up for questions and discussion. Is there anything about the joint component or dedicated plus or any of the new priorities that folks are unclear about or need to talk out some strategies about how to fit it into your community's plan? Okay, well, we've got about 15 minutes, so I will leave this open. I'll go ahead. I'll leave this page up so that you can write the information if you need. Yep.
It's Judith. I don't know if you can hear me or not, but
Hear you.
do you know if when you lease up units for the transitional housing portion of a joint project, do you have to adhere to the HUD market rate levels, or can the agency spend a little bit more? And are there any prohibitions against the agency owning the property and leasing it back? I know some programs you can and some you can't.
Okay, give me just a second. So the eligible costs, they are looking at the cost of new construction or acquisition, leasing of structure units, and operating costs to provide transitional housing specifically. Yeah, and then the tenant-based rental assistance is attached to the rapid rehousing portion.
Right.
So they're not going into a whole bunch of detail about it. Sorry, I'm skimming as
That's okay. And if you want to email me offline, I kind of looked through it and I didn't go into great depth because we actually had to get our first cut of our proposal into our CoC yesterday.
Oh, wow.
Yeah, and I'm actually doing an oral presentation to the committee tomorrow. So, it's sort of flying blind, so to speak, and I know that if my numbers don't hit what HUD says, I'll have to revise them. So I was just curious. I went with the HUD allowable cost for the lease up, but it sure would be nice if we could add a little bit more to that.
Yeah, do you mind typing that question up so that I can kind of stew on it?
Sure.
And try to get you an answer by close of business today.
Okay, and then the other question I had was when you're doing transitional housing to rapid rehousing, the joint project, you can do the category 2, and since the youth would be able to self-certify now, how is that going to work with coordinated entry?
Yeah, so that's a really good question. We have been, with the administrative transition over there, it's been a little difficult to get responses, I think, because things are still kind of transitioning, for lack of a better way of putting it. And so, even when Anne was still over there, it was difficult for us to get them to say anything publicly about the self-certification and kind of the coordinated entry tie-in to that. So hopefully, if we are able to get that in the appropriations language again, then I think we will be trying to do a one-pager, like a one-page memo that cites and references all of the relevant statutes so that providers can take it straight to their coordinated entry intake folks and say, you know, hey, you need to, this is how this needs to work. We would love to have that memo come straight from HUD, but like I said, because of the transition and the way that things are over there right now, I'm not going to hold my breath that that's going to happen. But if it's in law, then it's in law, and so we'll be able to come up with something.
Great, thank you.
You're welcome. If you're online, you can also use the chat box to submit a question if you have anything. Or comment. I'm open to comments as well. Is anybody else on the call considering trying to do the joint component? And if so, have you had guidance from anyone within your CoC to help? Has that been, so we just had another person say that they're going for the joint project and submitted some information to their CoC yesterday as well. So is that kind of the general consensus from folks on the phone, that CoCs are asking for kind of a preliminary application before the August, what did I say, 15th or 29th rather, deadline?
Hey, Amy, it's Judith again. That's the way our CoC has always worked. You submit a 4-page proposal for the funding that's available, a maximum 4-page with a brief budget, and then they look at what comes in and select the ones that they're interested in to do an oral presentation, and then the committee decides who gets to apply and for what amount. So, and then you're basically totally supported all the way through the application process.
Wow. Well, that's encouraging to hear that there's support.
Yeah, we generally put in our draft and it gets reviewed by the person who's in charge of submitting the CoC's application and double checks it for errors and does that T crossed right and that sort of thing.
Right.
And goes back and forth until it's like certified perfect and then it's submitted. Wow.
That's considering where this conversation was 5 years ago, 6 years ago, that's really something to hear. I'm happy to hear that. And one of our folks in California said their process is similar too. So progress. It's really all of this work that's happening on the ground. You know, it's so crucial to changing the path and the view that we have of ending youth homelessness here in America as a whole, as a country. So they also have a similar process up in Washington State as well. So like I said, at this point, we've got about 5 or 6 minutes left. So I am going to mute myself. But if you come up with any questions or you want to type a question in, please feel free. And I will use the last few minutes to try to address it or add it to my list of things to look into deeper after this call. All right, I'm going to go ahead and close this out. If anybody has any last minute burning questions or anything that you think of later in the day, please feel free to email me. And I hope that you all have a good rest of your week and good luck on the next 2 weeks of getting all of this process finalized. For those of you that have rank and review panels tomorrow, good luck, and please keep in touch and let us know how it goes. All right, with that, talk to everyone later. Bye.